CDC says it's likely COVID-19 vaccines are causing some cases of heart inflammation in adolescents and young adults, but most cases have been very mild. The CDC reporting its findings today after taking a closer look at data involving the Pfizer and Moderna vaccines. Health officials say young men under 30 are most at risk of this condition called myocarditis. The most common sign is chest pain within a week of getting the second dose. Doctors say the cases have been very mild, most people being treated with ibuprofen.
Yeah, we have seen about 3 or 4 cases here, and there was one case after first dose, but most cases were after the second dose of the vaccine.
Heart inflammation is also a symptom of COVID-19. Doctors say those cases tend to be more severe, so they still recommend everyone over the age of 12 get the vaccine.